talking about healthcare generally and thinking about how organisations, some of which are funded by government, some of which aren't, and they're perhaps charities or civil society organisations, are working hard to bring in a citizenship lens to a field in which the medical profession has to date kind of dominated and had perhaps the loudest voice. And so people who are perhaps using those services, needing those services, have had little say in how they might be organised, governed, and so forth. So the example I gave this morning, perhaps NHS Citizen, is maybe the best example of how that's beginning to become evident within England, and that was set up by NHS England, and they're keen to. They partly have a statutory obligation. So there's a new Care Act that's come about within England that obligates authorities to engage with the public, to engage with patients in a way that they haven't done so before. So I think NHS Citizen is about starting a process to make that a reality. It's still in its sort of early phases, and I think some people are wondering, well, is anything going to change? Who's this for, this movement? Is it for the NHS England board to actually say, tick, people are participating, we've done that? So perhaps critics might kind of have that view, and we're still waiting to see, I think. But I'm encouraged to see at least the language is more evident now within healthcare documents. So I think that's encouraging. I think it's in its infancy and maybe not even actually happening. One example where you imagine it could be happening is the Dementia Inclusive Community initiative, or Dementia Friendly Societies it's called, which I think it originated in Japan actually, but it's really taken off certainly across the UK and in Canada as well, I think. So in a way that's quite similar to disability inclusive and integration kind of discourse, which we heard about back in the sort of 1990s. But some of the slogans are evident, like nothing about us without us, but that seems to be the only one, and I'm not sure some people even realise that comes from the disability movement. I think they think this is people with dementia saying nothing about us, without perhaps fully appreciating the its historical significance and maybe some of the other principles and values that the physical disability movement had. So I think people can be quite focused and blinkered maybe in terms of the sort of the dementia angle, and certainly recently I kind of raised the question that should we be going down a sort of separatist path and just focusing on someone having dementia, whereas they might also have a learning disability, they might also be in a minority ethnic group, they might be gay, and so you might have a very dementia-friendly community, but it could be homophobic, it could be racist. So I do kind of question the focus is on a single aspect of someone's identity, i.e. their dementia, which seems to be what's happening within the field. And to my mind, that's perhaps not a fully kind of citizenship approach, I don't think, because it's not fully recognising other people's identities and the intersectionality between our different identities. Some of them are in terms of so direct payments, for example. It's I guess similar to sort of individualised funding, so someone can kind of opt to have direct payments. But the uptake of those is quite minimal, I think. But that option is there. It's not an area that I'm, it's not my area of sort of research or interest particularly. But I am aware that that's kind of an option for people. But I think one of the challenges, and certainly thinking about supported decision making, is that people often don't have anyone to support them in their decision making. And many people, if you have, some people have a spouse, so that they might have the support of their spouse, but that they could have perhaps other agendas, or they might have different needs or their own needs, so that they're perhaps not necessarily the best person to support someone in decision making. So I think sometimes there's an absence of an advocate or someone to support someone to make a decision, because often someone might receive a diagnosis of dementia, and then until they become, in need of quite a high degree of support, until there's some kind of crisis, there isn't any support necessarily for someone to perhaps make a living will, or to make decisions. The other thing I didn't mention in my talk was about the sort of potential role of technology in technologies, which I think we're not thinking enough about in this area. So how might we use technologies to support people in their decision making, or to enable people to self-determine and make decisions about what they might do, or to sort of fulfil their rights. We still seem to be in the we need to move from a service-led approach to a needs-led. In a way, it still seems to be at that stage. And I mean, it'd be good if services were perhaps more needs-led, but even that isn't enough, because you need to think beyond someone's perhaps just their care needs, to think more broadly about the other aspects of their life.